I'm Dr. Stan Tretter, Chief Medical Officer at Memorial Hospital and Healthcare Center. I wanted to provide an update today regarding COVID-19. As you are all aware, Governor Holcomb has now moved Indiana into Stage 5, which lifts further restrictions on gatherings and other activities in our community. And certainly this is great news for us, but I think it's very important that as a community we realize that we still are in the midst of a pandemic and still have many precautions that we must take in order to prevent the viral transmission from person to person throughout our community. We continue to see new cases of COVID-19 throughout our community in all age groups, including children and teens, young adults, older adults, and really throughout the whole population. Therefore, it still is very important that when we are out in public, that we maintain the use of face coverings, we maintain social distance of 6 feet or more between individuals, and that we use good hand hygiene, washing our hands and sanitizing in order to prevent that transmission. One of the questions that we're asked at Memorial Hospital is that since visitor restrictions are being lifted in other facilities, are we planning to do that as well at Memorial Hospital? And certainly we look forward to the time that we can do that, and we recognize how important it is for loved ones to be able to visit their family and friends in the hospital, as well as for those patients to have the support that they need while they are recovering. However, because the pandemic continues, we still must take precautions, and we continue our limitations that we have in place. At this time, we do permit 1 visitor for inpatients in many of our acute care settings. Some of our units have different restrictions. These would include our skilled care center, our inpatient rehab center, behavioral health, and the Caring Hands Geriatric Senior Services Center. Those do have different visitor restrictions, and I would encourage you to call those individual units to find out what their restrictions may be as of today. Some of our patients are required to be in isolation because of their illness. This may be because they have COVID-19, or perhaps they have another illness in which viral transmission can occur. For those patients, unfortunately, we are not able to allow visitors at this time. However, our nursing staff and physicians will work with families so that we can provide good, open communication between you and your loved one throughout their hospital stay. We will make every effort we can in order to keep you informed of their progress and allow you the opportunity to talk with your loved one while they are in the hospital. We still require masks when entering any of our facilities, and patients and visitors are screened appropriately with questions and temperatures before they enter our facilities. It's important that we continue these precautions because we have many patients who are certainly immunocompromised or ill and at risk of contracting infections from others. Therefore, we still need to take those precautions and keep those in place. Plus, we have to protect our employees and staff from others as well so that they can be there to provide the care that you need when you are sick. We hope that you understand that these restrictions are in place really for the well-being of our community and for our staff and our patients. However, we do look forward to the time when we can start to lift those restrictions. And please refer back to our website for current information regarding any policies we have on visitation. And finally, I would like to remind you that as we head into the cold and flu season this winter, flu vaccines are going to be a very important way that you can protect yourself and your family during this time of respiratory infections. We encourage everyone to get a flu shot this year so that you can protect yourself and protect each other. Thank you.